Hello, this is Dr. Naim, your favorite OBGYN. Today we're going to talk about hysteroscopy. This is a procedure done either in the office or usually in the hospital because it's easier for the patient. It involves putting camera through the cervix and looking inside the uterus to check for any anomalies like a polyp, fibroid, or any lesion that might cause any problem. Usually patients have irregular bleeding or heavy menses called menorrhagia. In this procedure, those patients usually get some blood work done, maybe ultrasound, and even try to be managed by hormone therapy like a birth control. If they don't work, then we do the hysteroscopy. And besides that, we can do things like endometrial ablation when we go and burn lining of the uterus for heavy periods, or we can do with a machine called MyoSure, remove the polyps or anything that might cause irregular bleeding. This is a very safe procedure and we do it on a regular basis, pretty much for irregular vaginal bleeding or treatment of menorrhagia or heavy menses.